Beginning with the external ear, inspect the auricle's size, shape, symmetry, landmarks, and color. Also note the color of the surrounding tissue and check for any abnormalities. The auricle should match the color of the facial skin and should have no deformities, lesions, or nodules. The preauricular area should have no openings or discharge. Now assess the auricle's position. Draw an imaginary line from the inner canthus of the eye to the most prominent part of the occiput. The top of the auricle should be at or above this line. Next, draw a perpendicular line in front of the auricle, which should tilt back by 10 degrees or less. Also inspect the external auditory canal, which should have no discharge or odor.
I'm going to feel your ears now.
Then palpate the auricles and mastoid areas. The auricles should feel firm and mobile, and should be free of nodules. The mastoid areas should have no tenderness or swelling.
When I press back here.
For the otoscopic examination, select the largest speculum that will fit comfortably in the patient's ear. To straighten the auditory canal, gently pull the auricle up and back. With the opposite hand, insert the otoscope about 1 to 1.5 centimeters.
If you could just turn your head.
For the best view of the auditory canal in a child, you may need to pull the auricle down and back. For a patient of any age, inspect the auditory canal, which should be pink with hairs in the outer third, but no lesions, discharge, or foreign bodies. You may see a little cerumen, which can vary in color and texture, but should be odorless. If cerumen blocks your view, remove it by irrigation or a cerumen spoon. In each ear, inspect the tympanic membrane, gently moving the otoscope to see the entire area. You should be able to see all landmarks, including the umbo, handle of malleus, and light reflex or cone of light. The tympanic membrane should look pearly gray and have no perforations. At the umbo, it should be slightly conical.
So I'm going to insert this
To assess tympanic membrane mobility, make sure the otoscope speculum fits well and seals the auditory canal. Then gently squeeze and release the bulb on the otoscope's pneumatic attachment. In response, the membrane should move in and out, causing a visible shift in the cone of light.
I'm going to whisper 3 letters.
Next, check the patient's hearing with the whispered voice, Weber, and Rinna tests.
I want you to take your finger and put it in your right ear and wiggle it while I'm testing the left ear.
Like this?
That's perfect. Now look straight ahead, please. 14.
At a distance of 30 to 60 centimeters, or 1 to 2 feet,
14.
the patient should respond correctly more than half the time.
C1V.
That sounds like C1V.
It is. That's good.
Next,
So far,
perform the
everything looks
Weber
great.
test.
Great.
To begin,
do a couple of
tap
hearing
or
tests
stroke
with
the
the
tines of a tuning fork to set it in vibration. Then place the base of the fork on the midline of the patient's skull.
Let me know if you hear, and I want you to tell me when you stop hearing the sound.
Okay.
To assess bone conduction, place the base of a vibrating tuning fork against the mastoid bone, and note how long it takes until the patient can no longer hear the sound.
Now.
Now I want you to tell me when you stop hearing the sound.
To assess air conduction, quickly move the vibrating tines 1 to 2 centimeters from the auditory canal. Note how long it takes until the patient can no longer hear the sound. Air conduction should be twice as long as bone conduction.
Now.
Okay, great. Now I'd like to examine your nose.
Okay.
While inspecting the external nose, note its size, shape, and color. Normally the nose is straight with no deviations. The skin is smooth and unswollen and matches the color of the face. The columella is midline, and the nares are oval-shaped and symmetrical, with no discharge, flaring, or narrowing.
You can bring your chin down. Now I'm going to be pressing on your nose. Let me know at any
Next,
point.
palpate the nose, placing one finger on each side of the bridge and moving gently over the soft tissues down to the tip. The nasal structures should feel firm and stable, with no tenderness, masses, or bone or cartilage displacement.
When I block this nostril, try to breathe in and out through the other.
Then check the patency of the nares by occluding one at a time.
That's good. Okay, now the other.
Through the open nares, nasal breathing should be noiseless and easy. Continue by inspecting the nasal cavity.
Okay.
To do this, use one hand to move the patient's head, and the other to slowly insert the nasal speculum, stabilizing it with your index finger. With the patient's head erect, inspect the nasal mucosa, vestibule, and inferior turbinate. Tilt the patient's head back to see the middle meatus and middle turbinate. Then move the speculum tip midline to view the septum. The nasal mucosa should be deep pink and glistening with no discharge, masses, or lesions. The turbinates should be the same color, firm, and unswollen. The septum should be midline and straight, with no perforations,
Now I'm
bleeding,
going to
or
check your
crusting.
sinuses.
Next, inspect the frontal and maxillary sinuses, which lie above and beside the nasal cavities. You should see no swelling. In a child under age 7, the frontal sinuses may not be developed yet, so focus your examination on the maxillary sinuses.
Maybe pressing on your sinuses.
Also,
Let me know
palpate
if
both
any
pairs of
areas-
sinuses.
Okay.
For the frontal sinuses, press your thumbs up against the brow bones.
No, that feels
For the maxillary sinuses, press up under the zygomatic processes. There should be no tenderness or swelling. Now,
gonna
with
be
the
examining
patient's
your
mouth
lips, and I'll need
closed,
you to keep your mouth
inspect
closed.
and palpate the lips. They should be pink, smooth, and symmetric, and they should have no swelling, lesions, or other surface abnormalities.
Okay, that's great. Now I'm going to be examining your mouth. I need you to give me a big smile and clench your teeth.
Next, examine the buccal mucosa, teeth, and gums. Ideally, the upper molars should interdigitate with the lower molars.
Very nice. Can you open your mouth now, please?
Next, inspect the oral structures using a tongue blade and bright light. The buccal mucosa should be pinkish red, smooth, and moist. The gums should appear slightly stippled and pink, with a clearly defined tight margin at each tooth. Also palpate the gums, which should be free of lesions,
hurt when
induration, thickening, masses, and tenderness. Then use a tongue blade to probe each tooth, which should be firmly anchored. Note any wear, notches, caries, or missing or loose teeth.
Can you stick out your tongue and hold it, please?
Next, inspect the tongue. It should look dull red, moist, and glistening, and should have no coating or ulcerations. The tongue should protrude fully, remain midline, and show no deviation or tremor.
Now I need to look under your tongue, so please take the tip of your tongue and put it behind your front teeth.
Normally, the ventral surface of the tongue is pink and smooth, with large veins between the frenulum and fimbriated folds, but with no swelling or varicosities. In an older patient, however, varicose veins under the tongue are an expected variation.
Now I need to look at the sides of your tongue.
Wrap a piece of gauze around the tongue and pull the tongue to each side to inspect its lateral borders. You should see no white or red margins or ulcerations.
Okay, that's great. Now I'm going to feel inside your mouth.
Continue by palpating the tongue and floor of the mouth. The tongue should feel smooth and even in texture. And you should find no nodules, ulcerations, or areas of induration.
Now I need you to tilt your head back, open your mouth wide so I can look at the roof of your mouth.
Okay, I need to take a look in your throat with this.
If a young child resists the oral examination, ask a parent to hold her with one arm across her arms
Try to open your mouth.
and the other across her
Okay,
forehead
Mom, can you
to
help
restrain
out?
her
Just
gently
put your
yet
hand on her
effectively.
forehead and on her arms. That would be great. Okay, say ah.
Usually, the whitish hard palate is dome-shaped, has transverse rugae, and smoothly meets the pinker soft palate, which extends to the uvula at the midline.
Okay, you can straighten your head up. Great. Now I need you to open wide and say ah.
As the patient vocalizes, the soft palate should rise symmetrically, and the uvula should remain midline.
Okay, that's great. Now I just need to look at the back of your mouth, so if you could open wide.
When inspecting the oropharynx, observe the tonsillar pillars and retropharyngeal wall. If present, the tonsils should be pink like the pharynx and shouldn't project past the tonsillar pillars. The retropharyngeal wall should be smooth, glistening, and pink, with small blood vessels and spots of lymphatic tissue.
The last thing I need to do is test your gag reflex. And this should
Using a tongue depressor, touch the posterior wall of the pharynx on each side. This should elicit a bilateral response. By using inspection, palpation, and a few special techniques, you can easily examine your patient's ears, nose, and throat. And by putting these findings together with the health history and diagnostic test results, you'll have a clear clinical picture that can guide your patient's health care effectively.